Hello everyone, this is the first presentation I'm recording. Hopefully this works very well. It is on Raynaud's disease, which is one of the best candidates for using biofeedback along with tension headache. Some of the ones that aren't so good are insomnia and anxiety disorders, and the least end of the spectrum would be visual disorders and diabetes. I'm going to go over some treatment and a little bit of evidence as well as the disease itself. So what is Raynaud's disease? It's when the spasms caused in the extremity cause color change, which is due to the loss of blood flow. And this is when the arteries constrict. I'll go over that in just a minute with a diagram. And it can last from minutes to hours. The most damage will happen when it's a longer duration, of course, and the blood flow is restricted for up to hours. It can happen primary, which is on its own, or secondary, which is when it's only within the context of rheumatoid arthritis, lupus, or other disorders. And the trauma described is from repetitive movements. This can be like operating a jackhammer for 10 years, or typing repetitively. So here are the phases of Raynaud's. The first phase shows a hand where the blood is just beginning to drain. This is when the vasoconstriction is beginning to cut off the blood flow. Picture 2 is when the lack of blood flow causes oxygen depletion in the tissue and the fingers are trying to conserve energy. They will start to turn blue because of the lack of oxygen. And in phase 3, the blood begins to return, and so the color begins to return to normal in the tissue. If phase 2 continues for too long, we can actually see tissue damage, but this is really rare in Raynaud's. What are the symptoms and who gets Raynaud's? The symptoms are caused, as we mentioned, by vasoconstriction, which is the lowered blood flow to the extremity. And although I'm using fingertips in most of these examples, it can also happen in the toes, the nose, the ears, or even the nipples. And this is the same places you would see extremities becoming very painful if you were to expose yourself to cold weather. And that's a normal bodily response. Primary Raynaud's usually occurs in females at above 4:1 ratio, so it's much higher to happen in females than males. It's usually between adolescence and 30s, and it begins with cold exposure or emotional stress. So what sets Raynaud's off from that normal bodily response is that it happens because you're having an emotional reaction. This fits into many of the paradigms we've been talking about for biofeedback about the stress response and the zebra not having anxiety or having anxiety and being able to deal with it. So the cold exposure causes this reaction, which is over the top. The body should not be going this far. And although it may feel numb sometimes, if it's painful for the client, it may cause more distress, and you'll have to address that issue, is that it's mostly considered benign. In extreme cases, though, it can cause things like gangrene, which is going to be tissue damage over long courses of time not having blood. So what does Raynaud's look like? We've talked about the symptoms and how the blood flow can be cut off. Here are a couple pictures of the white phase up top and the blue phase down at the bottom, which is often seen as purple, and that's because of the underlying color of the red skin and the blood flow. The pictures at the top show how it can either be straight across or more splotchy, and at times it can even be like just the bottom knuckle, so it'll look like a band. Here's a more biological diagram, and again we're using the hands as an example, and this is because when people get it in the hands or face, it's usually very embarrassing and their body is overreacting and they don't want to share, and that's the cause of embarrassment is what leads them to seek therapy, not actually any pain or numb or tingling. Usually a medical doctor has told them, look, it's just the vasoconstriction happening, there's no long-term tissue damage, you'll be alright, but it can be uncomfortable and that can cause them to come in, or it can be a source of embarrassment. So this diagram, of course, is the vasoconstriction. To the left we see normal, healthy blood flow, and to the right is when an attack is occurring and the vasoconstriction closes off the blood flow. And on the top right you can see the fingers become purple because there's no blood flow going up there. It's not always completely cut off, it's usually just a decrease in blood flow. Before we begin treatment, we want to have a lot of client education. As we've talked about, many of these disorders are going to take different sorts of client education. For this case, it's a lot of talking about protecting the body from the cold and ceasing smoking and caffeine intake. This is also kind of a test to see whether or not they're going to commit to therapy and whether or not they're motivated to take care of their well-being, is if they're unwilling to do these things. Protecting the body from the cold is important because we talked about this is a normal bodily reaction to extreme stress. We don't want the body to think that very low levels of cold are stressful, but we do still need a threshold where the body's going to react with this. And another reason why clients will come in is because they're on medication from a doctor and the side effects that are caused. A common medication is calcium blockers or depressants. So, where's the evidence that biofeedback is going to work? Here it is. It's Friedman, Yanni, and Wienig is the first really powerful effect size that really put this on the forefront and connected with Raynaud's. There's 3 types of therapy that they looked at, which is autogenic therapy, biofeedback, and thermal biofeedback plus cold stress challenge. The chart you're looking at is the reduction in symptomatology. So we'll use the example that somebody has 9 attacks in a week per average. If they get autogenic therapy, which is going to be dialectic, just talking about it, and relaxation, and going over biology and how to protect your hands, the symptomatology, which is the 9 attacks, should decrease by about a third. So that person would only have 6 attacks per week. If they got biofeedback, which is the autogenic therapy, plus seeing how that affects what's going on inside and being able to test it with a figure, then we would see a decrease from 9 attacks to about 3 attacks, so 2/3 of a reduction in symptomatology. When we add this cold stress challenge, we get an effect size of 92.5% decrease in symptomatology. That is incredible. I love to see numbers like this. It's very inspiring for psychological therapy. So what we see is that cold stress challenge, being able to submit yourself to the thing which causes these attacks within the therapeutic environment, almost completely wipes out symptomatology. The best part is that this wasn't a one-time thing. This lasted 2 years after the study. They did a long-term follow-up. So what happened? Why did we go from having these spastic attacks of vasoconstriction to being able to control it and they not happening? We don't know. Further study is needed. So who's a good candidate for this? Is it just anybody with Raynaud's is immediately a good candidate? I'm including the interview sheet, which is straight from the book, and it's a step-by-step protocol on how to assess whether or not somebody would be a good candidate and all the questions that you need to gather. Be sure to get a medical evaluation. This is very important because if you are just training Raynaud's and that's all they came in for and later it comes out that they have lupus, you're doing a huge disservice to that person and putting them in danger. You want to try and start treatment in late summer if possible, and this is because there's fewer symptoms and the client should have more hope. They're also usually lower duration and frequency and intensity, so if they are gaining some control and they're able to stop a very mild attack, that's going to get them more hope and build up their confidence and motivate them so that later on, when it's more intense, they know that they can at least do that milder one. So some of the self-report data that we want to collect before starting and getting a baseline is on that sheet. It's frequency, duration, intensity, and there's a lot of other questions that kind of get at this, but we want the client to be able to observe. This isn't just for our data and a baseline, it's also so they start noticing what situations put them into an attack. We also want them to cease caffeine and smoking, and that is because they can immediately get effects from that. If they're high intensity and frequency, we want them to have relief as soon as possible. Beware when you're taking your first measurements, as well as the entire time of treatment, that perspiration can cause artifacts, and this can even be as minute as the humidity in the air from one day to another. Please feel free to review the protocol. It's pretty interesting and very in-depth. It's only about 17 questions. So I know this is kind of a comical looking picture here. It's just an illustrative drawing of what it looks like, and they described it as Pavlovian conditioning, which makes sense because it's conditioned and unconditioned responses. Inside, see by the wood stove would be an ambient temperature where the client would feel comfortable and their feet are submerged in warm water. In this case, the client would have Raynaud's in her feet, not her hands or her nose. Her feet is what's being treated. So we submerge them in warm water and get used to the warm water and what that feels like, and then move outside to the cold stress challenge where the entire body is cold, and normally the body automatically responds with an attack of the feet. But because the feet are warmed, the body is able to understand this compensation and get used to what that warm water feels like in addition to being cold. So that when you're not in the warm water, you can transpose not having an attack in your mind with being cold. So we're pretty much breaking the conditioned stimulus. So what does treatment look like? Treatment usually lasts about 8 to 16 sessions, although it can be more, especially in extreme cases. Beware of when you get a baseline the first time somebody comes in for treatment, because finger temperature may not reach its baseline for about 10 minutes after you're in the session. So you might want to have a couple minutes of client education and background check before you even get hooked up. And this is because you don't know if they were in a rush to get in or what kind of stress was going on in the waiting room. We keep this training session to about 15 minutes, and that's because finger temperature is so minute that we really only want to see like one small gain and then cut off. Just introduce and then stop. If they spend so much of their effort in the first time and then get out and realize they've had pretty much what they perceive as no improvement, it's gonna just lose hope and the entire session's moot. Remind the client to bundle up in cold weather. This is because they may think they're stupid or human and that cold no longer affects them because the symptom is gone. And you have to have client education that cold should affect everyone at a certain threshold. Also, you don't want to be constantly doing stress challenges because you may undo that Pavlovian conditioning that you had just worked on. Finally, I want to talk a little bit about realistic treatment. This picture shows how there's two environments. There's the comfortable one, which you may be able to recreate in your office with the use of having a radiator that keeps the entire airflow very constant, not setting the client near any drafty windows or air conditioning units that'll come on and cause an attack. You could have a very ambient temperature and use the warm water method, but you don't have a separate refrigerator room to step into and do this cold test. You are just going to have to spend so much money to do it. Unless your office also is sitting next to a restaurant that's going to allow you to take clients into the refrigerator room, it's probably not going to happen. So we can go through the biofeedback, and as we saw in the study, this is the best case scenario. This is what causes an extra third of decrease of symptomatology. It's going to be really hard to recreate this. Unfortunately, financial constraints are limiting that extra third, although it's the best for the clients. This may require some creativity then on our part on going to the mountains or having a room that's kept really cold.